Do you think exercise is the best way to lose weight?
No, we've been taught this mantra that it's just calories in, calories out. Basically, people are being gaslit by the medical profession.
Dr. Paul Mason is a world-leading sports medicine physician who has helped thousands of people lose weight and fix disease.
He will help you burn fat like never before, and it starts with a high-fat diet.
In effect, we're telling the patient, if you cannot lose weight, that just means that you're greedy and lazy. I've had doctors as patients, I've had elite athletes, I've had CEOs, I've had all sorts of people. They're not lazy. The most powerful influence is something called hormones. Insulin is actually a hormone of obesity. It tells the body to store fat. And this is what a lot of people can't get their head around. They think, well, if I've got too much body fat, it must be because I'm eating too much fat. In actual fact, the fat that you eat, the body burns very readily. As soon as you put carbohydrates and highly processed foods into the equation, you're releasing massive amounts of insulin that just puts our body into fat storage form. There's no such thing as a one-size-fits-all diet. There are some diets that are going to be universally unhealthy.
Is there a minimum amount of protein that women and men should consume?
I will generally recommend they have at least 2 grams of protein per kilogram of body weight.
What about fat and how much fat?
So in terms of fat, well, some fat can be toxic.
I want to ask you about fibre for weight loss. Do you think fibre is good for weight loss?
Well, no.
This episode features Dr. Paul Mason, and he'll explain the only proven way to lose weight and prevent disease without counting calories or excessive exercise. And once you know this, you'll never be on a diet again. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button because we know that food is medicine. And by the simple act of subscribing, you can help share the message to millions more people that need to hear the truth. And now for the episode with Dr. Paul Mason. Dr. Mason, welcome.
Thank you.
When you look around us, most people want to lose weight, and you'll see hundreds, if not thousands of ways to lose weight online. But 99% of people fail. And they fail because they're getting the wrong advice from doctors, from social media, even ChatGPT. So today, Dr. Mason is going to share his evidence-based approach to lose weight and also heal chronic inflammation. And it's probably going to be different to what you've heard before. So Dr. Mason, my first question. You are a highly qualified doctor. You have 3 bachelor degrees, a fellowship, and you train Olympians and athletes. So if anybody could answer this question, it would be you. Do you think exercise is the best way to lose weight?
No. I mean, that's a very short answer. But we like to say you can't outrun a bad diet. So a lot of people say, well, we've been taught this mantra that it's just calories in, calories out. So if I have a patient come in and usually, they'll say, I'm coming here for weight loss. And I'll ask them full well knowing what their answer will be. I say, well, what have you done in the past? And say, I've done Weight Watchers, I've tried calorie control, I've exercised, so on and so forth. And we talk to them about the advice they've had from their doctors. And it invariably comes down to this calorie counting model. You need to eat less and exercise more. Now, but if we pause for a second, so we're putting the complete responsibility back on the patient in terms of 2 behaviors. 1, eating how much you eat, which is greed, and 1, how much you exercise, which is lazy. In effect, we're telling the patient, if you cannot lose weight, and clearly you're sitting there, you're overweight, you don't have the ideal habitus, that just means that you're greedy and lazy. Now, the thing is, I've had doctors come in as patients. I've had elite athletes come in. I've had CEOs. I've had all sorts of people. And people who are type A personalities who are incredibly driven, they're not lazy. They don't lack self-control. They're up at 5 a.m. every morning doing boot camp right before they go and run their, 1,000-employee organization. These people have got their stuff together. It's not just down to an attitude. So basically, people are being gaslit by the medical profession. So then the question is, okay, if we understand it's not because you're greedy and it's not because you're lazy, then what is it? And the most powerful influence is something called hormones. And people really underestimate the power of hormones. I mean, if you've ever seen a dog on heat, you'll have a little Jack Russell who'll scale a 6-foot fence purely on the basis of hormones, chemicals circulating around their body, chemicals stimulating the brain. And in actual fact, hormones are so powerful that they will control our behavior, our eating behaviors, but they also control what our bodies do in terms of fat storage. It's fair to say that there's one hormone, which is called insulin, without which most nobody would be overweight. Insulin is actually a hormone of obesity. It tells the body to store fat. And then we have these other chemical influences in the brain that drive eating behaviors. And we can understand it's not so simplistic as just eating less and exercising more. It's what in our lifestyle influences these complex hormonal interactions. So I'll give you an example. So everybody will think that when you pick something up and put food in your mouth, that's a volitional action. So that must be completely in your control. Sure. Can you just take a deep breath for me and hold it? Great. So you've proven to me that you can control your breathing. Perfect. Now hold your breath for 5 minutes.
There's no way.
You probably won't. But why not? The drive to breathe is just controlled by chemicals, right? It's just controlled by oxygen levels, carbon dioxide levels. It's just under chemical control. And we've got conscious control of our breathing. And yet at some point in time, that unconscious desire to breathe becomes irresistible. And it's the same with food. It's the same with eating. And if we don't put ourselves in the right situation, give ourselves the right tools to control food cravings and desires, then you're really no more in control of your eating than you are of your breathing. That's a bit of an extreme example. There's obviously, more bad things will happen much quicker if you don't breathe than if you don't eat, but they still will happen. So food now is incredibly addictive. I went to America recently for a conference, and I was at the Statue of Liberty, and I happened to be standing next to a lady in the queue, and I got chatting to her, and she was just a scientist, and she worked for a large donut company. And I was curious, and I said, so what do you do? Food scientist, donut company, that sounds very interesting. And she talked through the process of, how they would craft the food, and they'd have taste testing panels and whole teams of people to make the food very addictive, the right combination of sugar, salt and fat, and all got to get the mouthfeel right. And she was also incredibly proud how they can add all these preservatives to a donut so that you could have a donut that was 3 weeks old sitting out in the open air, and it was completely indistinguishable from a fresh donut. But that's beside the point. The point is these foods are addictive. And as humans, we have evolved to respond to addictive stimuli. So the two behaviors that the human species is dependent on for survival is procreation and eating. And both those behaviors are driven by serotonin and dopamine, which are two happy chemicals. We call them neurotransmitters in our brain. They get released. So if you've sort of got deficient levels of these chemicals, which can happen for, certain health reasons, if you've got an iron deficiency or what we call chronic inflammation, which is a bit of a broad term, but if we have these issues in our body, that lowers our neurotransmitter levels. But we're hardwired as humans to chase these chemicals. So what do? What's our most ready access to get a supply of these chemicals when we're deficient? Well, in our modern environment, when we're surrounded by addictive foods, we just go to addictive food. So that's a huge drive. And we think we're in control of our eating, but we're often not. And then the consequences are not just that these foods are addictive, but what they do to our hormone levels. So with all these sugar and carbohydrates, we know they release a hormone called insulin from our pancreas into our bloodstream. And insulin is the hormone of obesity. So without insulin, our fat cells cannot get fat. That's our fat cells can only store fat under the influence of insulin. In actual fact, they did a very interesting study on some adolescents, and they measured their insulin levels. And they just put them into 4 groups. You're in the bottom 25%, top 25% or one of the two middle quartiles. And they followed them for 8 years. And then at the end of the 8 years, they measured the insulin levels again to see who was in the bottom, the top. And they found that if you were in the top level of insulin at both points of time across that 8-year period, then your chance of becoming obese was something like 36 times greater than the people with the lowest insulin levels. So we've got very strong prospective data. Any type 1 diabetic, as a doctor, we're a condition called type 1 diabetes, which is where the body releases not enough insulin. The pancreas, the beta islet cells in the pancreas, which makes insulin actually die, and you can't produce insulin. So how does a type 1 diabetic present? Well, they're emaciated, they waste away. And it's not just fat, it's muscle too. Their whole bodies waste away. Essentially, they'll die. So we treat them with insulin injections, which is life-saving, which is another facet. And then, so what happens? Where do we tell them to inject? We say just inject in your lower abdomen. And if they use large doses of insulin because they're, for whatever reason, and they don't rotate their insulin sites, they're always injecting into the same sites in the lower abdomen, well, you get these mounds of fat tissue forming there. We know in type 1 diabetics that where they inject, they develop fat masses. And we're not just talking about a little bit lumpy. If you want to Google this, lipo, meaning fat hypertrophy meaning excessive growth, you'll get some fascinating images. It looks like mammary glands or breast tissue, which is plastered onto the lower abdomen. They're really quite prominent lumps. So the evidence that we have that the hormones drive obesity is absolutely huge. So you've got these two factors. We've got addictive food, and often we understand we're hardwired to chase dopamine and serotonin, which these addictive foods provide. And especially if we're in a state of ill health, iron deficiency, B12 deficiency, chronic inflammation, what have you, then, and we're going to be relatively depressed, we're going to be living in a black cloud or a grey veil. And the way that we get transient release out of that is by eating these very addictive foods. We get a squirt of dopamine and serotonin into our brains, and transiently we'll feel good. That is such a strong driving force. Just because you're thinking, oh, this is a volitional action, putting food into my mouth. No, it's not under your volitional control. Eventually, you will fail. And if then the food that we choose to eat to break that is releasing huge amounts of insulin into our bloodstream, and that's what people don't realize, that as soon as you put carbohydrates and highly processed foods into the equation, you're releasing massive amounts of insulin that just puts our body into fat storage form. And here's another thing. You think with all that energy coming in that you'll have energy to burn, that your body will say, hey, I've got heaps of energy here, I'm going to be very active. No. In actual fact, what the insulin does is you've got a choice. That energy that comes in, your body can stuff it straight into the fat stores, or it can direct it to be burnt for energy. And insulin takes it away from that available energy and stuffs it into fat stores. So even though you've got all of this energy coming in, your body doesn't perceive that it's available. And this is why you might feel lethargic at the same time. So we've actually done research where we've put people on diets that will lead to lower insulin levels. And we've found that even for consuming the exact same amount of calories, they're calorie-controlled diets, that people on the lower carbohydrate diets will burn at rest, just sitting down, 300 kilocalories more per day. Now, for reference, that's the same as if you were going for a bike ride for an hour. So when it comes to weight loss, it's not just eat less and exercise more. Now, if you could eat less and exercise more, that could lead to weight loss, but that doesn't tell you how to do it. The fact is these things are under the chemical drive of dopamine and serotonin in the brain. And then what you do with those chemicals is under the hormonal influence of insulin. And if you're having a diet that is excessively addictive, you're just going to want to eat that, and then leading to all of these chronic inflammations, nutrient deficiencies, and high levels of insulin, your body's just going to store it as fat. So I'll get another element here, and I'm sorry if this is going to be getting a little bit too complex, but let's just add a third concept to it. And that's a concept of nutrition. So I just briefly talked about nutrient deficiency. So are you familiar with what we call total parenteral feeding?
No, what is that?
So it's what happens, let's say if you had a problem with your throat or your stomach and for some reason you couldn't eat, but we'd still need to give you nutrition. So we would just take one of your veins and would put in a large cannula, and we could feed you all the nutrition that you needed through a vein. So, and presumably, if we provided you with every nutrient, micronutrient, macronutrient that you needed, then you could stay healthy. Makes sense. So in the 1970s, they did a fabulous study where they experimented with what would happen when they manipulated the micronutrient composition of what was coming in. Now, the thing to understand is that through urine tests and blood tests, we have markers that tell us how much fat you're forming, how much bone and muscle you're forming, or whether indeed you're breaking things down. And we found that if we, say, took away sodium, which is salt, that's found in sodium chloride, which is table salt, if we took away the sodium, then we could reduce your ability to form muscle and bone by about 2/3. If we eliminated potassium completely, we could basically completely stop all bone and muscle formation. So these little things are actually very necessary for our body to build lean tissues. Now, and it's pretty obvious. If you imagine that muscle contains potassium, and you completely eliminate all potassium from your diet, then how is your body going to make muscle when you take it in? It's like if you're trying to build a complex recipe and you take 3 key ingredients out. You can't just add more of the other ingredients and make that recipe. It's if you're missing something substantial, you just can't do it. It's essential. So if we take potassium out of your diet, then you really are deficient in building muscle and bone. And this was an absolutely huge insight. But then what happens? You're still taking in the same amount of energy. So where does that energy go? Well, in this study, that excess energy that was no longer able to form muscle and bone was turned into fat. So, there's multiple factors here that influence whether or not you gain fat. Now, the corollary of that is that we just have to do that in reverse to lose weight. And it shouldn't come down. You shouldn't have to be white-knuckling it and resisting. We know that, these type A personalities who can be very driven, they can actually control things to such a degree that, for often extended periods of time, they can control their weight. But eventually it's like trying to hold your breath. Eventually you have to take a breath and eventually you will fail. And that's where the whole calories in, calories out falls down. And then to just throw something else in, just as an aside, the people who can actually succeed will say you've got a middle-aged female who's been able to control her weight for 20 years, with extreme regimen of exercise and extremely low-calorie diet. If we actually look at her, she would have often what we'd consider to be disordered eating. So the simple fact there, I see this in a lot of my patients, a lot of the people who are able to control their weight, it's such, with the standard advice, it's so extreme what they have to do to go to success, but basically they have an eating disorder. That's not healthy.
I want to ask you, moving on, because I think people, they've heard a lot about insulin and then the byproduct when you have too much insulin resistance.
Well, hang on. If we can just back up there for a moment. So you've just actually raised something that is very commonly thought of in the low-carb community, which I think is wrong. And it's the connection between too much insulin causing insulin resistance. And I know that is cited and by some very credible people in this field, but the more I look into the science of it, it just doesn't make sense. So the notion is that, let's say if you go to a loud concert and you're hearing a lot of noise and you walk out of the concert and your hearing's a bit muffled afterwards. Your hearing's gotten used to the loud noises. It's not that sensitive. The same if you go into a room with a bad smell. If you go on a hike in the snow for a couple of weeks with a group of people, then you're all going to be a bit pongy at the end of it, but you don't notice it because your body habituates to the smell. And the notion is that insulin is the same. If you just expose yourself to a high level of insulin, the body gets used to that level of insulin. But the evidence actually suggests that that doesn't happen. And without going to the details too much, it actually looks like the problem of insulin resistance happens from too much sugar and too much seed oil in general. So insulin is a chemical that circulates through the blood, and it goes to a cell, and that cell has what we call an insulin receptor, which has a particular affinity for insulin. It doesn't want to see any other chemical. The only chemical it wants to see is insulin. And when insulin comes in and joins to that receptor, that triggers a whole downstream cascade of cellular machinery doing stuff, such as saying, oh, let's store fats on and so forth. Now, what happens if we've got that receptor that takes insulin and then we just fill it with chewing gum? Insulin comes along and it can't get in, it can't activate the receptor. Then you have a problem. So the problem of insulin resistance is actually a broken receptor. And when I'm looking at the literature, it's actually fairly clear how the receptor gets broken. So the receptor is actually sitting in a special section of the cell membrane. It's sitting, think of the cell like a ball, and you've got these little areas of cell membrane, they're called lipid rafts, and they're extremely dense in cholesterol. So we know that cell membranes contain a lot of cholesterol, but the lipid raft region actually contains more than 5 times the amount of cholesterol as the surrounding membrane. So these little lakes or rafts of lipid, that's where the insulin receptor sits. And when you consume too much sugar, your liver produces a compound which is toxic to the lipid raft called a ceramide. And when you consume too much seed oil, there's actually a plant form of cholesterol. It's a plant analog of cholesterol. It's close to human cholesterol, which means it can be absorbed by the body in small amounts, but it's different enough that it doesn't work the same. And this too goes to the lipid raft and damages the function. And once this lipid raft is destabilized, then the insulin receptor in the lipid raft can't work. So insulin comes along and it doesn't activate it properly. But here's the problem. We have slightly different types of lipid rafts between muscle tissue, liver tissue, and fat tissue. So guess which tissue doesn't get as affected by these? That's the fat tissue. So you impair the signaling to the liver and the muscle, but the fat tissue can still work. So the fat tissue, insulin's acting on that, and that can still take up all the energy. But the important benefits of your muscles taking up energy to burn, well, that's less efficient. And the liver taking up the sugar to store as glycogen, well, that becomes less efficient, so on and so forth. So this is the real problem of insulin. It's not to do with a chronically high exposure to insulin. It's primarily due to a very high carbohydrate diet, especially sugar diet, because that tells the liver to produce something called a ceramide. You may have heard of this process called de novo lipogenesis. So de novo lipogenesis basically is the liver making fat. And what does it make fat out of? It makes fat out of carbohydrates. And this is what a lot of people can't get their head around. They think, well, if I've got too much body fat, it must be because I'm eating too much fat. In actual fact, the fat that you eat, the body burns very readily. It's very hard for the body to break down fat and then to restore it. It's much easier for the body to actually make fat from carbohydrates. That's the fat that typically gets stored. But it's also, that's the fat that when you produce that fat, it's a particular type of fat. It's called a palmitate that turns into this ceramide chemical called ceramide palmitate, and that damages the lipid raft, and that causes insulin resistance. So that's the actual mechanism of insulin resistance. And this also speaks to the age-old argument. I'm sure you've had people say, oh, seed oils, they're the devil. And people say, oh, it's all about the carbohydrates. And it's almost like we've got two camps of people in the low-carb community. Some people are afraid of sugar. Some people are afraid of seed oils. Well, in actual fact, they're both toxic. And it's just a dose that informs us about the poison. It's like if you have more seed oils than you do carbohydrates, then the seed oils will be worse. If you have more carbs than seed oils, and vice versa. But on average, when we look at the literature, it appears that for a diet that's about 50 to 70% carbohydrate, that would have about the same impact on your health as a seed oil, a diet that had about 6% of energy coming from seed oils. So if you understand that, then consider that the average Australian gets about 13% of their energy from seed oils. It actually looks like seed oils may actually be even more problematic in the diet than carbohydrates for most people.
As Dr. Mason mentions, if you want to lose weight, you need to eat more fat and avoid carbohydrates and seed oils. Now, what you eat is so important for overall health and to lose weight. But one big thing that stops people from losing weight is past trauma, stress, and emotional eating. Now, this is something that I suffered with for most of my life, severe emotional eating. I was even reaching for healthy sugars just to feel okay. And what I found completely fixed this, along with a high fat carnivore diet, was to understand my emotions through therapy. Now, through speaking with a therapist, I was able to understand my triggers that led to emotional eating. And my therapist came up with incredible strategies to help me fix my emotional eating. Things like relaxation techniques like guided meditation, slow breathing, and gratitude, just to name a few. Now, this has helped me so much, and that is why I have BetterHelp as a sponsor of today's video. BetterHelp is on a mission to make starting therapy easier. All you have to do is fill out a questionnaire and you'll be matched with a therapist in as little as a couple of days. One of the best features about BetterHelp is that if the first therapist doesn't feel quite right, you can easily switch to another one until you find someone that you truly connect with. They're all about creating the best experience and support for you. So if you're struggling and you think you might benefit from therapy, just click on the link in the description of this video or head to betterhelp.com/Primal Podcast and get 10% off your first month of therapy. We spoke about insulin. You corrected the insulin resistance. Fantastic. Thank you so much. Pertaining to hormones, there's also leptin and cortisol. Does that play a role in people's inability to lose weight? How important are those?
So for most people, not that important. So there's an interaction between leptin and insulin. So in effect, if you deal with the insulin, you're going to be dealing with the leptin. So I used to test the leptin levels on every patient, and that was academically informative, but it didn't change management, because we just saw this tight relationship between what's happening with the insulin and what's happening with the leptin. We just know that we fix the insulin and we don't need to worry about the leptin. And the reference intervals that the laboratories will give you for leptin are just so nonsense. It makes, if you're interpreting it based on the reference intervals, you're going to be out of luck. In terms of things like cortisol, for some people that is hugely important. So I've got condition called Cushing's syndrome or Cushing's disease. If you take too much steroid because you've got a chronic inflammatory illness, or you might have a problem with your adrenal gland where that secretes too much cortisol, then that absolutely will cause obesity as well as a bunch of other side effects. And occasionally I do cortisol level testing in most of my patients who come in because I don't want to miss this. But the reality is for most people, it's actually not that important. But there are other hormones that we have to always test. So take the thyroid gland, for example. So what we call subclinical hypothyroidism, which is really a euphemism for saying an underactive thyroid that standard blood testing doesn't detect. That's really what it means. That is very common, and that absolutely contributes to weight gain. And it also will contribute to elevated cholesterol levels and elevated triglyceride levels. So we'll see a lot of people come in and they'll say, oh, my doctor put me on a statin because I've got high cholesterol levels. And you'll look at them. And the way I think about cholesterol is not as a disease. If we treat it like a disease, where you've got high cholesterol, here's the drug you need. No, it's as a symptom. If you have high cholesterol, it's because there's something else going on with your body. Now, and I'm not talking about, just mid-range, cholesterol that the reference intervals call high, because we know that, the very basis of, the targets for cholesterol have just lowered over the years, and it's basically, it seems to have basically been done to increase the amount of people who take its lipid-lowering therapies, the number of people over the last 20, 30 years who are eligible for cholesterol medication has actually increased 600%. That's just because we keep moving the goalposts down. So I'm not talking about just slightly high cholesterol. I'm talking about proper high cholesterol. But if you've got proper high cholesterol, then we shouldn't look at it like a symptom. Well, we should look at it like a symptom, and not a disease. So it might be that you've got an underactive thyroid gland. It might be that you're actually deficient in B12. How many doctors realize that low B12 causes the body to increase production of cholesterol, for example? Often we see high triglyceride levels in people who have what we call hemochromatosis. And it doesn't mean that you have to have both genes for hemochromatosis. You could just have what we call a carrier state where you've got one affected gene. And that will frequently lead to elevated liver enzymes, for example, elevated triglycerides. So we do need to have visibility of these things across the board. So for most people, the key is insulin. But there is a certain subset of people who do have other hormonal disturbances. And that would probably be in the vicinity of 10 to 20%. So, most people, they're not issues, but they're certainly worth checking for.
So the 80 to 90% solution is to fix your insulin if you want to try to lose weight, because it's a hormonal issue, not the calories issue. I have further questions around that, around the calories, because people are going to say, well, so can you eat 5,000 calories a day, but keep your insulin low and lose weight?
So it's very hard to eat 5,000 calories a day and keeping your insulin levels low. Now, one of the things is that even on a carnivore diet, for example, people don't realize that meat stimulates a reasonable insulin response. Now, it probably gram for gram, the insulin response from meat is, or calorie for calorie, is probably about half that of carbohydrates. So it's significantly less, but it is still significant. So you'll remember earlier on I talked about the type 1 diabetic who doesn't produce any insulin at all. I said they come in emaciated, no fat, and I also said no muscle, because insulin is a very important growth hormone. Insulin is important. We don't want zero insulin at all. It would turn into a type 1 diabetic. You need it for muscle tissue as well, which is why some bodybuilders, they probably still do, will inject insulin. It's an anabolic hormone, builds muscle. You obviously just have to control what you're doing from the fat. So in terms of, well, I'm not sure if that really...
It made sense because I understand, because I'm just thinking about people in the comments, what they're going to be saying, that I believe in the calorie counting theory, or hormones matter, but also calories matter as well.
But what about these females with eating disorders who can stay lean on a insulin stimulating diet? The calorie theory can work. The problem is that it doesn't control for calories. The diet has to allow you to control your caloric intake. So when you lower your insulin level, you lower how much energy is being pushed into your fat stores, you've got more energy available, you're just going to be less hungry. So the hormones actually control the drive to eat. Avoiding addictive foods will allow you to control the drive to eat. So the calories in, calories out model is theoretically correct. So anybody who's ever lost weight on a carnivore diet has done so under the auspices of them eating less and exercising more, or eating less than they're burning. And that's absolutely true. But the issue is one of control. So the standard low-fat, high-carbohydrate diet makes you hungry. It drives you to eat more. You're not providing your body with nutrient-dense food, so your body's going to be needing more and more food to control for that. Whereas a healthy diet, if you're now 5,000 calories a day, now I honestly don't know how many calories I eat, but I will tell you, I eat to satiety every time I eat. I'm never hungry. I'm literally never hungry. I'm a bit of a hedonist because I don't like to, why would I want to make myself hungry? People say, do you fast? And I think the benefits of fasting, by the way, are seen in people predominantly who are on unhealthy diets. And if you're on a healthy ketogenic diet, then I don't think the benefits of fasting are going to be significant. So it comes down to, does your diet make you hungry, and does your diet make you overeat? Of course, if you overeat, you will gain weight. Now, you can probably be, for example, go on a carnivore diet, and if you force yourself to eat, of course you'll gain weight. But the whole point is that we just want people to eat to satiety, eat when they're hungry, don't eat when they're not hungry. And for the most part, people eating healthily will lose weight even when eating to satiety. If you've ever traveled through the savannah in Africa, and you'll often see where the lions have killed some deer or antelope, and you'll see the carcass is just left there. They don't keep eating. Once they're full, they just leave it.
I want to ask about carbohydrates because that seems to be the main trigger the main thing that we need to control or lower if we want to lower the insulin and therefore lose weight. So then how do you know how low to keep the carbohydrates and what diet to do?
So it really depends on the person. So you raise a really important point there, what diet to do. So there's no such thing as a one-size-fits-all diet. However, there are some diets that are going to be universally unhealthy, and there's going to be some diets which are going to be universally healthy. But they're at extremes, and the question is, whereabouts on that do you need to go the extreme low-carb diet, high fat, so on and so forth, or can you be a bit more relaxed and still get the results you need? And when I say it's no one-size-fits-all, it's on a continuum. So if I've got an athlete, they might be able to have 100 grams of carbohydrates a day, which is a reasonable amount, and still be in perfectly good health. Whereas somebody else who's extremely insulin resistant, they've been metabolically damaged over decades, they can probably look at a donut from across the road and have an insulin spike. So my favorite tool for that is a continuous glucose monitor, which is a little device. It's about the size of a 20-cent piece. It just sticks onto the back of your arm, and it communicates wirelessly with your phone, and you get real-time readouts on what your sugar response is to the foods that you're consuming. And this is absolutely fabulous. So some people come in and say, well, can I eat this particular food? And I'll say, well, how many grams of it? How rapidly? Is it going to be at the start of a meal or at the end of a meal? Because that affects how things are digested as well. So the only way to know whether you can consume a particular food in a particular amount at a particular time for your personal metabolism is to actually assess whether it's causing a spike in your blood sugar level. And we know that if you're getting a spike in your blood sugar level, then that's a reasonable surrogate marker to say, well, you're probably going to be getting insulin spiking and some deleterious effects going on. So the question is, how many carbs can I consume? It has to be answered by personal experimentation. And we're fortunate now that we've got these beautiful devices, the continuous glucose monitors. You don't have to wear one continuously. You get one, wear it for 10 days or 14 days, depending on the country you're in. They have different durations. And use it and learn from it. If you see particular food spike your sugar levels, you should not consume that food. Or at least, be mindful of what it's doing to you when you consume that food. And if you're seeing that you can consume, bacon and eggs for breakfast and your sugar level stays perfectly level, then that's absolutely fine. Now, just a couple of words of caution on the continuous glucose monitor. They don't measure the concentration of sugar in your blood the way the finger prick glucose does. They don't actually sit inside your blood vessels. They sit in the fluid around the blood vessels. It's called the interstitial fluid. And so basically the sugar level in that fluid reaches an equilibrium with the sugar concentration going through the blood vessels over about 5 minutes or more. So it just delay behind a finger prick glucose measure. But also because it doesn't measure the concentration, it measures the amount of sugar being delivered to the fluid around the blood vessels. It's affected by blood flow. So what does that mean? So if you increase your circulation, say if you're exercising or if you go and have a hot shower or a sauna, then the blood flow around the sensor is going to increase. So the delivery of sugar to the sensor is going to increase. I often have patients come to me and say, oh my goodness, I'm worried about exercising. Every time I exercise, my sugar level spikes up through the roof. It's absolutely crazy. And it's like, well, that's actually a bit of a spurious finding. The delivery of sugar to the meter has increased, but your sugar level almost certainly didn't. And if you cross-reference that with a finger prick, you'd see the truth. So just be mindful, there are certain things about it. And in terms of the absolute level of it, it's simply not as accurate as a finger prick. But that doesn't really matter because we're not really worried about the absolute level. We're worried about avoiding the spikes that occur with the diet. So it's very similar to, as a doctor, when we were learning about ECGs, there's something called a T wave. And if you've got too much potassium, that can affect the shape of the T wave. And we were taught if it looks like you wouldn't want to sit on it, as in if it looks like a spike, then it's probably pathological. And I think we can probably say the same thing about glucose spiking on a continuous glucose trace.
That's so interesting because I experience the same thing. If I'm stressed, the blood glucose spikes, or nervous, or if I exercise. I want to ask you a question around if people have lowered the carbohydrates depending on what their blood glucose monitor recommends and what foods are good. So they've found that right carbohydrate level and then they're losing weight. Have you experienced with your patients or your clients that you might see, they hit a weight loss stall and they can't understand why they can't lose weight? What's happening there?
I think you know the answer here, but we call it non-scale victories, and that's what we want to have relevance to. Remember that feeding study where we put the drips in people's arms and we fed them nutrients and we could control how much muscle or bone they were forming? So on a healthy diet, you're likely to be reversing, hopefully, osteoporosis, building lean muscle, at the same time you're losing fat. So if you've got two tissues going up, two tissues which, by the way, are strongly associated with longevity and health, then that could offset any apparent weight loss on the scale. So there's a couple of different ways to look at this. So number one, the mirror test. How do you look in the mirror? I mean, the mirror doesn't really lie. Number two, you can do what we call a waist circumference measure. Now, the waist circumference measure is actually my preferred measure, but you need to do it in a certain way to make sure it's reproducible and accurate. Now, the way we get taught in medicine is that we tell people to measure around their waist, and, sometimes it's between the bottom of the ribs and the top of the waist, and it's all very varied, and it's very difficult to get a reproducible measure. And also, if somebody has what we call a pendulous abdomen where the stomach hangs down, then how do you know you're getting it around the maximum girth? And as people lose weight, are they measuring it at the same level? Now, if you lie flat on your back, then the pendulous abdomen goes away. Gravity just brings it back, and you just end up with a vertical mound that is perfectly centered. And then if you wrap the tape measure around at the level of your belly button, then that is completely reproducible. You can always hit that level every time you measure. So my recommendation is to lie on your back, wrap a tape measure around the level of your belly button, just give it a bit of a cinch so it's always the same tension, and that is your measure. And that will tell you about these non-scale victories. Because a lot of people come in, they say, I'm still losing weight, my clothes are getting looser, but I'm obsessed by the scale and the scale's not moving. And the whole point is that that's because you're probably getting healthier. You've probably got more muscle than you used to. You've probably got more bone density. We frequently see bone osteoporosis actually reverse. And this is something that in medical school we were taught never happens. But how many people know what bone is made of? You ask people what bone is made of, and they'll say one thing: calcium. But calcium is only a fraction of it. So in actual fact, bone is a scaffolding of protein in which you have other minerals like calcium and fancy things called hydroxyapatite, phosphate, so on and so forth, that get impregnated into that protein scaffolding. So you absolutely need a high protein diet to build bone. And this has actually been proven in a randomized controlled trial. It was some Australian researchers, I think it was back in 2002. And they came up with that was still back when everybody was saying, it's all about calcium. So they gave some people with osteoporosis. So these were males and females over the age of 65, so postmenopausal. They gave them some calcium. And because we know that vitamin D helps you absorb calcium, they gave them vitamin D as well. And then they looked to see if they could reverse osteoporosis. And what they found is that it reduced the decline in bone mineral density. It controlled the progression, but it didn't seem to reverse it. And that sort of makes sense because our bodies, if we need more calcium, our bodies will break down bone to get at that calcium. Our bone is basically a calcium bank. So it will break down. But if you're having regular calcium coming in, then you reduce your body's need to break down bone to get at that calcium. But if you're not putting in protein, you're not giving the body all the ingredients. Remember this whole recipe thing we talked about, missing ingredients? If you're not putting everything in, then you're not allowing the body to rebuild the bone. So then these researchers did something very clever. They divided the study participants into 3 groups based on their protein intake. And what did they find? In the group with the highest protein intake, the top tertile, they actually were reversing their osteoporosis. So you've got postmenopausal females who are growing more bone density in their hip joint, in their hip bone, what we call the neck of the femur. So this is just absolutely fabulous. So, and it just gives visibility to this whole thing that you actually can build these healthy tissues on a healthy diet. And of course, that's going to be shown on the scale. So your weight will sometimes go up. So let's not focus on the number. Let's look at the waist circumference.
Very, very true. You mentioned protein. So I want to ask you a question about protein and fat, because that's the other macronutrients that we have to consider. Is there a minimum amount of protein that women and men should consume? And also, what about fat and how much fat is appropriate?
Well, let's go with both of those. So is there a minimum? I mean, the thing about protein, we think of protein as just a nutrient, right? But we've got 20 odd amino acids. We've got essential amino acids that the body can't make. We've got non-essential ones. We've got conditionally essential ones that the body can only make enough of under certain circumstances. So it's not enough to talk about protein in just terms of a number like that, because what happens if you're having plant protein, which might be deficient in certain amino acids? Then no amount of protein is going to save you from that. If you're having a complete animal protein, then that's going to put you in a better position. So it's a bit academically disingenuous to say you need to have X grams of protein per kilogram body weight per day without having consideration for the source of the protein. And we know we have different scores for the bioavailability of protein. And essentially we know that animal protein will have better scores for bioavailability than plant proteins. And that's a fact. So in terms of how much protein should you be having, so the studies they did, they working out how much protein is recommended with the dietary guidelines, they were based on college-aged males. And they were based on protein solely as a substrate for structure. Basically, remember I said that we can get an assessment if your body's breaking down protein or forming protein by looking at other metabolites in the body, in the blood and the urine. So they were looking at these metabolites and they found the minimum amount of protein at which it looked like, you were maintaining your level of muscle and bone. And that was something like 0.8 grams per kilogram per day. But that also overlooks the role of protein, the enzymatic role of protein. And proteins have a lot of other roles in the body besides just building stuff. It's pretty handy that they build stuff, but they're immune proteins, they're enzymes, so on and so forth. So a bunch of other important stuff. So it really looks like that recommendation in college-age males who probably absorb it far better than most other people, they may actually even have less requirements, say a pregnant female, so on and so forth. Or, so there's a lot of reasons why that 0.8 is grossly, deficient. And I would probably suggest it's reasonable to at least double that as a minimum requirement for good health. So just because you've got something for, that can keep you alive, it doesn't mean that it's anywhere near optimal. And in actual fact, I would generally recommend, for my patients, I will generally recommend they have at least 2 grams of protein per kilogram of body weight per day, especially if they're trying to reverse osteoporosis. And, the calculations are quite easily done. So in general, animal food is about 25% protein. So if you've got a 400 gram steak there's about 100 grams of protein in that steak. So we need to think about it as something that's more than just a homogeneous nutrient. It is very complex. And we also understand that when you get protein in the diet, you're not just getting protein. Where do you get? So if we look at meat, that's zinc, that's iron, that's taurine, that's carnitine, that's carnosine. There's all these other nutrients that you don't get from plant foods. So protein should be considered just one mix. So we shouldn't consider meat to just be a protein source. We should consider meat to be a nutrient source, micronutrient, as well as a protein macronutrient. So in terms of fat, well, some fat can be toxic. So remember we talked about these phytosterols, these plant analogues of human cholesterol. So they're clearly toxic. They're toxic to our cells and to our insulin sensitivity and so on and so forth. So if we were to include, vegetable oils as a source of fat in our total daily fat recommendation, you can see, well, that's completely counterproductive. So we do have some fats which are also considered to be essential. And here's the problem. So we've all heard of omega-3 fats, typically from fish oil, but you can get it from pastured meats as well. And we consider the omega-6 fats that are often found in seed oils to be toxic. And yet, omega-6 fats are every bit as essential in the diet as are omega-3 fats. And this is where I think that a lot of us and I used to get this wrong as well. I used to think that omega-6 fats were inherently inflammatory. Now, it is true that seed oils contain omega-6 fats, and that seed oils, when we consume them to excess, they appear to be quite deleterious to our health. The problem is assuming that it's the omega-6 content of the seed oils that causes the damage. In actual fact, I think there's two main factors. One is their phytosterol content, and number two is something called oxidation. So oxidation just refers to the chemical tendency, to remove an electron from the outer shell, the valence shell of another molecule. And that's, if we think about it, that's basically what rusting is. If we have a piece of iron, we leave it outside, it rusts, it gets oxidized. So in terms of why seed oils, I believe, are deleterious, I don't think it's the omega-6 content per se. I think it's actually because they have a lot of oxidation stress in them. And we can measure this oxidation in the blood. If we feed people oils, seed oils, and within a couple of hours, we can measure the oxidation products. And it actually is even worse for diabetes. So on average, they'll stay in your circulation for 8 hours unless you have poorly controlled blood sugar levels. And then we can detect it for 9 times longer for up to 72 hours or 3 days. So that's why seed oils are bad. So when we're talking about what fat you should have, well, you should have some omega-3, you should have some omega-6. I personally think that because of the hormonal influences of saturated fat, in terms of it doesn't really stimulate much insulin, so on and so forth, it's a good source of energy. I think we should be having plenty of saturated fats as well. But it depends on how you're getting it. Did you know that meat also has omega-6 fats in it? Now, just to digress a little bit, just to explain to people why I don't believe that omega-6 is inherently inflammatory. Because we know that omega-6 can be inflammatory. So what do I mean? So omega-6 fats turn into this chemical called arachidonic acid. And arachidonic acid is that when we have people who get infections or what have you, we know that, or injuries, then there's a signal. Their body is signaling to turn this arachidonic acid into other chemicals that can cause pain and clotting and so on and so forth, what we generally call inflammation. And so we're assuming that arachidonic acid is inflammatory. And yet we've done studies where we put people on low carbohydrate diets, which are low in seed oils, and we've actually observed the arachidonic acid, which is produced from omega-6. We've observed that to increase. Now, how on God's green earth would arachidonic acid increase if you're actually lowering the omega-6 coming in? And the reason is, when we talked about these inflammatory signals that will then turn the arachidonic acid into inflammatory chemicals, that's a signal-driven pathway. You actually need to be in an inflammatory state before the arachidonic acid becomes these, leukotriene and so on and so forth. So what happens if you put the body into a healthier state? You don't have these same triggers that convert the arachidonic acid, and so the arachidonic acid will accumulate. And it's not a problem if it accumulates, because it's only inflammatory when you've got a trigger. So if you take away the inflammatory triggers because you're on a healthy diet and what have you, you might be having less grains and less pesticides and whatever else going into the body that can trigger some of these effects. So in itself, the omega-6 and the subsequent arachidonic acid is not inflammatory, and it is every bit as essential as omega-3. The point is that we do get a heap of omega-6 in our diet, though, through seed oils, and we get very, very little in the way of omega-3, except for canola oil, which is a 2-to-1 ratio. But so I guess that's a very difficult question for me to answer, how much fat we need. The answer is so much more complex. But what I would say is that rather than trying to work it out on the back of an envelope, the way we have eaten naturally throughout history provides us with what we need. So and seed oils weren't a part of our natural diet, so don't eat seed oils. Saturated fat was, and if you're eating meat, if it's pastured meat, you can get a lot of omega-3 as well as omega-6. So just making sure that you're eating food that's been raised naturally and packaged naturally, and you're going to get all the right components of the fat that you need. Now, interestingly, I was on a holiday recently. We had a long weekend, and so we went to a supermarket. It's a bit of a bespoke supermarket in Australia. It's called Harris Farm. It's sort of, it's in nicer towns. Yeah, but a bit more expensive. But I'd like to have a look, and I was on holiday, so I had a bit of time. And they had some tallow, and they had Wagyu tallow and grass-fed tallow side by side. Now, I wish I could share. I took a photo of them with you. Now, you had this beautiful yellow colouring in the grass-fed tallow, and we know that Wagyu is just fed grains, and that was just completely white. So we can clearly see the differences in nutrition between grass-fed and grain-fed meat. So that does actually make a difference. Now, I'm not saying grain-fed meat is bad, but it certainly does miss out on some of the nutrients that we have in the grass-fed meat. So if, for example, you can only afford grain-fed meat, then it would be well worth making sure you're having some sardines or something like that that's going to be giving you these other fats that you're probably going to be missing out on.
Okay. Bit of a bold question for you. To sum it up for people that want to think, okay, I want to lose weight, I want to get healthy. What should they focus on? Meat and butter or exercise? If you had to pick one.
So, clearly diet is more important than exercise for overall health. However, the option that you've just given is not perfect for everybody. The option of butter and steak. For example, we know that dairy for a lot of people is a problematic food. It's so historically, dairy, we're consuming dairy products into adulthood when historically we've only ever consumed them when young. And not only that, we're consuming a dairy product of a different species. So it's actually quite interesting that we would somehow think that this would be appropriate from a natural perspective. And the truth is that we do see lots of people who have reactions to dairy, and it causes far more problems than I think people appreciate. Now, obviously, butter is mainly fat, and you could always go to clarified butter, which is ghee, which has even more fat content, less protein content. So, but just be mindful that this is not a one-size-fits-all diet. And, sometimes foods which are, say, for example, considered carnivore, animal-based, some people might assume, well, it's animal-based, therefore it's going to be okay. Well, for some people, those foods are not perfect. And the reality is there's going to be some plant foods out there that a lot of people will be able to tolerate. So, and I think this actually, maybe we don't have time for it now, but leads to a bigger conversation about what has changed about our food supply now. We know that the fruits and vegetables we're growing today are completely nutrient deficient because of the way we've treated the soil compared to what they were 50, 80 years ago. So we know, for example, in some regions, the amount of copper in a vegetable is about 75% less than it used to be. I mean, completely nutrient deficient compared to what they were. And we've got oodles of pesticides through our food now. And I just saw yesterday that there was another lawsuit against, I think it might Monsanto or something like that, where they paid out another 70 or however many $1 million in a cancer lawsuit. And we've got, if you just have a look at all of these lawsuits going on around the world with pesticides and causing cancers and so on and so forth, it makes a fascinating reading, and it really should ask the question, are these pesticides safe for us to be consuming now? And authorities will have us believe that they're completely safe, and there's lots of legal cases on at the moment where people would suggest that they're perhaps not as safe as we'd think. So the whole thing is it's not just, all vegetables are necessarily bad, but perhaps the vegetables we're having now, which are depleted of nutrients and probably containing, several different pesticides, that could be a problem.
That's why I said it was a bold question. It wasn't to say that people should just eat steak and butter. It's because people are really confused because everything sounds bad and they don't know what to eat. And that's where that question was leading to. Focus on what you eat. Of course, move. Of course, do exercise. It's important. But pertaining to weight loss, it's not the best thing. It's important for other aspects of overall health. I want to ask you about fiber for weight loss. Do you think fiber is good for weight loss?
No.
It doesn't make you feel fuller for longer?
Well, so no. There's a lot to unpack in that question. So we're often told that fiber is an essential part of a healthy diet. But let's just throw back to a common criticism made against meat, that it putrefies in the gut. Have you ever heard anybody making that argument?
I've heard many arguments about meat, no vitamin C, not enough nutrients. It stays in your gut. You have no bowel movements.
Exactly. Meat stays in the gut, that it putrefies. I've heard the particular term putrefaction, that it rots, that the body, it just doesn't do anything for the body. Now, let's talk about fiber. We talk about what is the supposed benefit of fiber. The supposed benefit is that it feeds your microbiome. So how does it feed your microbiome? Why isn't the body digesting it? If the body did digest it, it wouldn't be there to feed the microbiome, would it? Because we've heard the term indigestible fiber. It is completely, so insoluble fiber, we can't touch it. It doesn't get digested at all. So it feeds the bacteria. So what's another name for feeding bacteria? Rotting, putrefaction. The argument that's leveled against meat that it rots in the gut is not only wrong, it's gaslighting of the 10th degree, because that's exactly what happens with fiber. We can't digest fiber. And it's not like we have four stomachs. We're not a ruminant like a cow. It's not the way our gastrointestinal tract is designed to ferment massive amounts of fiber. If you actually have a look at the structure of our colon, where a lot of the fermentation would occur in primates and other animals, we've actually got a relatively modest size of our colon. We do have a small capacity for it, but it doesn't seem to be necessary, and it's certainly not something that's focused on within our gastrointestinal system. So when I used to work in hospitals as a junior doctor, I actually did a couple of rotations of colorectal surgery. And we would have patients with what's called colostomy bags, where they'd have the bag coming out of their stomach, and that would be collecting all their fecal material. And interestingly, patients full well knew that when they'd consumed lots of fruits and veggies and nuts and so on and so forth, their bag would be filling and overflowing. And I had more than one patient tell me about accidents where the bag overflew. And when they were eating just meat, the bag would relatively remain empty. Why? Because the body can digest everything that's in the meat. So this whole notion that you get blocked up with meat and so on and so forth just doesn't make sense. Whereas with fibre, the body can't digest it. And so when bacteria digest something, they produce a lot of gas. So, which is why people will often feel bloated. The whole volume of the gastrointestinal tract is only about 1 litre. And it's all in many loops of bowel, so on and so forth. So if you have a small volume of gas in any one of those constrained areas, that will be quite uncomfortable. So we've got very clear evidence that people who consume the most fibre will often have increased gastrointestinal distress. And when they've actually done experimental studies where they eliminate fibre from people's diets, and I'm not talking about just reduce, well, they had several arms with they'll reduce it, but also completely eliminate it as far as practicable, they actually found that symptoms of constipation, including bloating and straining and so on and so forth, actually significantly improved. Now, we do know that if we define constipation as regularity of bowel motion or size of bowel motion or something like that, then with that artificial definition, there will be research that says fibre is good for constipation, because if you're putting in a whole heap more mass that your body can't digest, it's going to have to come out, and it's going to probably come out more regularly. So that is true. So if we define constipation as just frequency of bowel actions, but if we were to define constipation as pain, bloating, actual symptoms that bother people rather than just a tally, then the evidence is that eliminating fibre is actually beneficial for those gut symptoms. And it doesn't appear to be that fibre is necessary for our colonic health. Now, the bacteria, while they do produce gas and make you feel uncomfortable and so on and so forth, they can also produce some short-chain fatty acids. And these short-chain fatty acids can be taken up by cells lining the colon, lining the intestine, and that will provide it with some energy. But guess what these colonocytes turn the short-chain fatty acids into before they use them for energy? Ketones. So if you're on a ketogenic diet where you've got ketones circulating around in your bloodstream full stop, then that's going to be having the same nourishing benefit to your colonocytes as would consuming the fibre. So now it's because some people say, I just need to have the fibre to nourish my bowel. And you probably don't need to. Now, there are some people who seem to do like taking insoluble fibre, and insoluble fibre certainly doesn't seem to have the same level of side effect. Soluble fibre. Soluble fibre doesn't seem to have the same level of side effect as people consuming insoluble fibre. And for example, so strawberries, I think, are predominantly soluble fibre, whereas blackberries, for example, may be more insoluble fibre. So there is a bit of nuance to it. And if you are wanting to have fibre, and that's just because you believe you need being told to, you may find that the soluble fibre is less disturbing.
But it's not good for weight loss.
Well, no, it's not. I mean,
just to clear it up, because that's what people hear. If you go on ChatGPT and you ask how to lose weight, it's all these questions I'm asking you. Or if you go online and people see it, it's all these things that I'm asking you. And then they think this. That's why I ask you these questions.
Yeah, which is a fair question, but because logically you'd think, well, it displaces, my desire to eat must be just based on the volume that's in the stomach. In which case, if that was true, you'd just have a glass of water every time you wanted to eat, and that should totally suppress your hunger. And clearly that doesn't. So, why would a solid mass that stretches the stomach be any more effective at suppressing appetite than a liquid mass stretching the stomach? If you think about it, it's illogical.
Okay. Can I ask you about lectins? Because that might be something that people don't quite understand. That has been linked to a lot of I shouldn't say chronic inflammation, but a lot of problems in the body, but also linked to inability to lose weight. How does that work? And firstly, what are lectins and what are the foods that have lectins?
So basically, plant foods contain lectins. Now, lectins are what we call a carbohydrate binding protein. So they're little proteins in the food that can bind to carbohydrate molecules. Now, understand that we actually have lots of carbohydrate molecules on our cells as cell receptors and so on and so forth. So we often call them glycoproteins, where you've got a bit of a protein with a glyco or a carbohydrate cap to it, and lectins can actually bind to that. Now, interestingly, there are some lectins. So we talked about insulin receptors earlier and how insulin comes along and this receptor really just has an affinity for insulin. Now, I was probably a little incomplete because there's some chemicals that can actually bind to the insulin receptors, and they're lectins. And some of these chemicals have actually been shown to bind to the insulin receptors even more avidly than insulin itself, which is quite astonishing. And when you activate the insulin receptor, well, especially on fat cells, one of the effects is going to be weight gain. So this notion about how lectins might possibly contribute to weight gain is very well established by activating the insulin receptor. They do a whole lot of other deleterious things too, though. So you may have heard, well, let's talk about reflux. So a lot of people find that when they eat a lot of grains, they get reflux. If we feed grains to cows, we actually have to give them copious amounts of calcium. Otherwise, they could potentially even have stomach ulcers that burn holes through their stomach. Grains is not a natural food for cows, and my preference would be that cows wouldn't be fed grains. So the way this actually works is that there's an immune molecule called an IgE molecule that they react to the grains, the lectins in the grains, and these IgE molecules basically stimulate a series of pathways in the gut that release stomach acid. So eating grains actually stimulates a huge production of stomach acid, a release of stomach acid. And Dr. Eric Westman did a fabulous study some years ago now where they actually stuck nasogastric tubes down into the stomach of people, feed it through the nose down into the stomach, and they were actually measuring the acid levels. And they found that they had a significant drop in pH within 6 days of stopping eating grains. So this is these lectins, they have so many effects. You've probably heard of gluten. Well, gluten, we know that causes something called leaky gut. I think it's CXCR1 and zonulin, and there's all these molecular things. We don't need to talk about the names, but we know that, and it's not just in people with celiac disease. We can measure this in so-called healthy people. Taking gluten leads to leaky gut in most everybody. It's just that, the severity is worse in people with celiac disease. And gluten is a lectin. So these chemicals, let's talk about red kidney beans, for example. Now, there's a reason you can't buy raw kidney beans. It's because if you were to eat raw kidney beans, then as few as 4 could potentially be a lethal dose because they contain lectins, this is why we boil and soak a lot of our foods, because that actually makes them naturally safer. It breaks down some of the lectins. Now, there is a bit of confusion out there because people are well aware that traditional methods of food preparation, like soaking and boiling and so on and so forth, will actually break down a lot of lectins. But the reality is you can reduce the lectin load, but that's not the same as eliminating it. So my suggestion would be, well, do you want to make it, safer? Or do you want to make it safe? So there's a condition called Farvism. So our bodies have natural antioxidant defenses, and one of them is called G6PD. That produces something called glutathione. And glutathione is our most potent antioxidant that's released in the body. It is absolutely fabulous. So remember, we talked before about oxidation stress and electrons being pulled away and rusting. So our body is constantly protecting itself against oxidation stress. It's just unfortunate that our bodies work on oxygen, which naturally generates oxidative stress. Now, people with this condition called Farvism, they actually don't produce enough of their natural antioxidant. And when they eat fava beans, that can be absolutely deadly for them because these generate a large amount of oxidative stress. Now, for you or I, that wouldn't kill us because our bodies would ramp up the production of glutathione to protect us. But people with deficient glutathione production, we actually do see the deleterious effects of some of these foods. So lectins is a huge topic that we could probably talk about for 2 hours. It goes across multiple domains of health. But in essence, yes, they can cause lots of inflammation. They can cause, they absolutely have proven mechanisms to associate with weight gain, as well as other side effects.
I just wanted to ask about that because I think people don't know all these small other things that might make them gain weight, especially if they're or not being able to lose weight, especially if they're eating foods that are high in lectins. And I will have a bunch of foods listed in the description of this episode so people can see what foods are higher in lectins. A final question for you. So if people are eating meat and, higher fat foods and lower carb foods, let's just say those that they can tolerate, when it comes to fat cells themselves, can they shrink or what happens to the fat cells? Do they shrink or do they multiply and then get destroyed?
So in general, there are a couple of variations for this. And I used to believe that you had the maximum amount of fat cells you ever had at age of 2, and any change in your weight following that was just due to an increase or a decrease in size of the fat cell. Now, under some circumstances, you actually can form new fat cells, but it is still largely true that the bulk of change in your weight is not due to growing more fat cells, it's just due to the changes in size of your existing fat cells. And so I assist in neurosurgery once a week, and it's very interesting when we're actually making incisions and you actually go through the skin and then you get to the fat layer, and you can actually see in very big people who are quite overweight, you can see these large globular fat cells, and then very lean people, you see they're more sort of like grains of sand. So it's very interesting and something we can actually see macroscopically with the eye as well.
So when somebody loses weight, do their fat cells decrease in size?
Shrink. It's like a deflating balloon.
Ah, okay. But then it can inflate again if you eat more carbohydrates and sugars and seed oils.
Absolutely.
I think people think that fat loss is like really difficult and hard, but from what you're saying, it's very, very simple.
It's a science. You just follow the science. If you understand, you've got the chemical influences in the brain that can drive you to eat. You've got the hormonal influences in the body that will determine what you do with what you eat. And if you just control for both of those factors, weight loss can be quite reliable.
Wonderful. Well, Dr. Mason, thank you so much. That was incredible. I think I definitely learned more from you than I've learned 20 years and anything I've ever read or learned. If people would like to find you more, where can they find you?
So I've got a website which is slowly in the process of being updated. I do Twitter, or what is now known as X. So I think it's Dr. Paul Mason, MD. And I've got several lectures on my friend's website, Low Carb Down Under, which is a YouTube channel. And that was founded by my friend, Dr. Rod Taylor. And there's lectures from lots of people in the low carb sphere talking about everything from, sunlight to diet, from lots of fabulous speakers.
Wonderful. Well, thank you so much for your time, Dr. Mason, and I'm sure we're going to see you very soon.
Well, thank you. Really appreciate you having me here. It was wonderful to finally connect.
Thank you for joining me today on this episode with Dr. Paul Mason. Now, if you want to know more information about how to lose weight, everything is in the Primal Labs. All you have to do is go to the description of this video. There is a link there where it says learn more about how to lose weight. Open that up, and there is so much information there about how to lose weight. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button. That is an excellent zero-cost way to support this free health podcast. Now, you can also find me on other social media accounts. I'm on Instagram and on X, formerly known as Twitter, as I generally share different information to what you'll see here on YouTube. You can find me on those social media accounts under the name of the Primal Podcast. And finally, if you love this episode, you'll enjoy another episode I did with Dr. Jason Fung. Dr. Fung is a kidney doctor, but specializes in how to lose weight and intermittent fasting. Dr. Fung will discuss the number one way that you can lose weight without counting calories and how to start intermittent fasting the right way and some common mistakes that people make. Finally, thank you for your interest in root cause healing, and I'll see you next week.